Was actually busy inside, but quickly have to make this video. See my house. See my house. Yeah, this is what my house looked like, and I was trying to get to work. But then I've had like two calls. Like my phone kept ringing, and I keep hearing the same thing. What medication can I give my child? For the very for obtained time, I'm making this video and I am saying this for the obtained time. Please, I do not recommend medications. I don't recommend medication. I am not a doctor. I am not even a nurse. I am a mother on a journey with her special need child, and I am also learning on the journey. I'm learning as we progress. I'm learning as we move forward. It's true that these children might actually have the same diagnoses, but medical recommendation for drugs, for medication for them is different depending on their needs. Like now, Derek does thyroid medication. We manage his adenoid and other stuffs. I cannot recommend those medications for you because your child needs to go through adequate evaluation, adequate examination, so the doctor will be able to, I'm not a medical practitioner. I am not a professional. I am also learning on the journey as I journey with my child. So please, I don't recommend medication. I've had a few people call me and be like, my child have thyroid. I don't recommend thyroid medication. The dosage your child might be taking might be different from the dosage mine is taking. When we started thyroid medication for Derek, we started with 12 micrograms. As we keep repeating thyroid function, it was increased to 25 micrograms. I do not recommend. Please don't want to use your child for medical experiments. Don't want to act ignorantly. The fact that it's working for me might not actually be what your child needs per time. Before I give my child anything, I ensure I also, even when I walk into the pharmacy to buy, I explain to them in details what I want, and I am specific. They give it to me. I snap it, send it to a few people I know have knowledge with as it concerns this field, and I also try to read about it. Please don't act blindly to avoid shifting yourself from fry pan and setting your house on fire. Please, for the obtained time, I am not a medical professional. I am also learning as I join in. I am a mother on a journey with her special need child. Please. So I mostly say visit the hospital. The only medication I know is general, which some parents don't even, is DHA. Anywhere you go to in this world, they will say go buy DHA. That's what I know. I can be like, okay, are you giving DHA? Get DHA, and maybe multivitamin, which is anyone can just walk in, buy, and is what helps their immune system. But sensitive medication, pay attention, please, to the hospital. Their body accepts, everybody's body adapts and accepts and digests things differently. What is working for Derek might not actually work for your child, might be what will actually cause that child a lot of other complications. Hence why when you go to the hospital, I know is financially draining and tasking. Yes, but they will say, oh yeah, do this test, do this test, do this test. They will be able to, work with the result. And the hospital will not recommend any medication for you without adequate evaluation, examination, and reviews. It's very, very important. Please. I know human being, even as I'm making this video, I know someone will still call me tomorrow or send me a message tomorrow asking me to prescribe medication. But please, please, I am not a medical professional. I shout it, I loud it. I don't know anything about medical profession. I only have a layman idea and knowledge because of my child. So the knowledge I have is not deep, it's shallow, it's not professional, and deep enough to carry others along. Knowledge I have is not actually sufficient enough to accommodate you and your child's needs. So please, let's trade with caution. Please, let's not use our kids for medical experiments because it might not end well. What end well for A might not end well for B. Please, for the obtained time, I do not recommend medication, especially sensitive medication. Your baby or your child need professional attention, which I do not have. I don't have. So sharing my layman knowledge with you might not work for you because we handle these children according to their needs per time. They have the same diagnosis, but their needs differs. Okay,